Have you ever wondered if the very medical tests designed to keep you healthy might actually be causing harm to your lungs? It sounds almost unbelievable, but the truth is that several common medical procedures you've likely undergone could be silently affecting your lung health, emphasis, right now. What's truly alarming is that millions of Americans undergo these tests every year without ever being told about the potential risks. These are tests your doctor might have recommended without mentioning their hidden dangers. The good news is that after watching this video, you'll not only know exactly which tests to be cautious about, but you'll also discover simple steps to protect your precious lung health before permanent damage occurs. Because when it comes to breathing, you simply can't afford to take chances. The air flowing through your lungs is quite literally your lifeline, and today, we're going to make sure nothing compromises it. I want you to take a slow, deep breath right now. Feel that? That sensation of air filling your lungs, the gentle rise of your chest, it's something most of us take for granted until it becomes difficult. For many viewers watching this right now, breathing isn't as easy as it once was. Perhaps you've noticed yourself becoming winded after climbing a flight of stairs, or maybe you've developed that nagging cough that just won't seem to go away. You're not alone. Countless Americans are experiencing declining lung function without understanding why, and it's frightening to feel your breathing capacity diminish year after year. What's particularly concerning is that many people attribute these changes simply to aging, never suspecting that routine medical tests might be contributing to their respiratory issues. Think about it, we trust medical procedures to diagnose problems, not create them. That's why this information is so crucial, especially if you're over 60 and receiving regular medical care. Your lungs are remarkably resilient organs, but they're also uniquely vulnerable to certain types of damage that can occur during common diagnostic procedures. The frustration many patients feel is completely understandable. You've done everything right, you've scheduled your regular checkups, followed your doctor's recommendations, undergone all the suggested tests, only to find yourself struggling with unexplained breathing difficulties. It's like following the map exactly as instructed but still ending up at the wrong destination. What's worse is that once lung damage occurs, it can be incredibly difficult to reverse. That's why prevention and awareness are absolutely essential. Today, we're pulling back the curtain on 5 common medical tests that could be compromising your lung health without your knowledge. This isn't about creating fear, but rather empowering you with information that many healthcare providers simply aren't discussing with their patients. Because your breath is precious, and you deserve to know everything that might be affecting it. Let's start by understanding why your lungs are particularly vulnerable to certain medical procedures. Your respiratory system is designed with remarkable efficiency but also with surprising fragility. Each time you breathe, air travels through an intricate network of ever smaller passages until it reaches tiny air sacs called alveoli, where oxygen enters your bloodstream. This delicate system can be easily disrupted by foreign substances, radiation, and even some of the very procedures designed to diagnose other health issues. The first test we need to discuss is the traditional chest X-ray. While essential for diagnosing many conditions, repeated chest X-rays expose your lungs to ionizing radiation. Now, a single chest X-ray delivers a relatively low radiation dose, comparable to about 10 days of natural background radiation. However, the cumulative effect of multiple X-rays over years can potentially damage the sensitive tissues in your lungs. This radiation exposure has been linked to inflammation of lung tissue, which can trigger coughing, shortness of breath, and even increase susceptibility to infections. What many patients don't realize is that this damage doesn't always present symptoms immediately. It can develop slowly over months or even years after exposure, making it difficult to connect the dots between the medical test and the emerging breathing difficulties. By the time symptoms become noticeable, significant changes may have already occurred within your lung tissue. This delayed reaction is particularly concerning because it often leads both patients and doctors to look for other causes, overlooking the connection to previous medical tests. The consequences of this unrecognized damage can be far-reaching, affecting not just your physical health but your overall quality of life. Simple activities like walking with friends, playing with grandchildren, or even maintaining your home can become increasingly difficult as breathing becomes labored. The psychological impact shouldn't be underestimated either. The anxiety that comes with struggling to catch your breath can be overwhelming and isolating. That's why understanding these risks now is so important for protecting your future well-being. Now let's talk about CT scans, particularly those with contrast agents. CT scans deliver significantly more radiation than standard X-rays, sometimes equivalent to several hundred chest X-rays in a single procedure. While these scans provide invaluable diagnostic information, they come with considerable risks to lung tissue when performed repeatedly. Even more concerning are the contrast agents often used during these scans to improve image clarity. These substances can trigger allergic reactions in the lungs of sensitive individuals, leading to inflammation and breathing difficulties that may persist long after the scan is completed. I remember meeting George, a 72-year-old former teacher who came to our health center with increasingly severe breathing problems. For years, doctors had attributed his symptoms to age-related changes or possible early COPD. What they failed to consider was that George had undergone multiple CT scans with contrast for monitoring a benign liver condition. It wasn't until a respiratory specialist connected the timing of his breathing difficulties with his history of contrast-enhanced scans that the true cause became clear. By implementing some simple protective measures before future scans, George experienced noticeable improvement in his symptoms within just a few months. The third procedure we need to discuss is bronchoscopy, an examination where a thin tube is inserted through the nose or mouth to examine the airways. While this procedure is extremely valuable for diagnosing lung conditions, it carries risks that patients should be aware of. The process of inserting the bronchoscope can introduce bacteria into the lungs, potentially causing infections. Additionally, the procedure itself can trigger bronchospasm, a sudden tightening of the muscles around the airways, leading to difficulty breathing, wheezing, and increased mucus production. What makes this particularly concerning is that these symptoms may be mistakenly attributed to the condition being investigated rather than to the procedure itself. Pulmonary function tests represent our fourth concern. While these breathing tests are essential for diagnosing conditions like asthma and COPD, the shared mouthpieces and equipment can potentially expose patients to respiratory infections if not properly sterilized between uses. For individuals with already compromised lung function, these infections can cause significant setbacks. The solution isn't avoiding these important tests but rather ensuring proper protocols are followed and equipment is thoroughly sanitized. Finally, we need to discuss ventilation perfusion scans, commonly called V/Q scans, which are used to check for blood clots in the lungs. These tests involve inhaling a radioactive aerosol and receiving an injection of radioactive material. While the radiation dose is typically low, some patients experience irritation from the inhaled substances, which can trigger coughing, wheezing, or shortness of breath. For individuals with sensitive airways, these reactions can persist for days or even weeks following the procedure. What's particularly troubling about all these tests is that patients often aren't fully informed about these potential risks before consenting to the procedures. A study published in the Journal of Patient Safety found that less than 30% of patients felt they were adequately informed about the potential side effects of diagnostic imaging procedures. This information gap leaves many people unprepared to recognize warning signs or take preventive measures to protect their lung health. The good news is that there are effective strategies for minimizing these risks without foregoing necessary medical care. For instance, keeping a detailed medical imaging history can help you and your doctor track your cumulative radiation exposure. Discussing alternative imaging options that don't involve radiation, such as ultrasound or MRI, can sometimes provide the needed diagnostic information without the associated lung risks. Additionally, simple measures like proper hydration before and after contrast-enhanced scans can help your body process and eliminate the contrast agents more efficiently, reducing their impact on your lungs. Leading pulmonologists have been raising concerns about these issues for years, though their warnings haven't always reached the general public. Dr. Elizabeth Harmon, Director of Respiratory Medicine at Northeastern Medical Center, explains that the cumulative effect of multiple diagnostic procedures on lung health is something we're only beginning to fully understand. The evidence suggests we need a more cautious approach, particularly with elderly patients whose lungs may already have reduced function due to age. Research from the American Thoracic Society has revealed that patients who undergo multiple chest imaging procedures within a short time frame show measurable changes in lung tissue samples. These changes include increased inflammatory markers and alterations to the delicate alveoli structures responsible for oxygen exchange. While these changes don't always lead to symptoms, they can make the lungs more vulnerable to other stressors like pollution, infections, or additional medical procedures. Traditional medical wisdom has always emphasized the importance of protecting the lungs from external irritants, but modern medicine has sometimes overlooked the potential impact of diagnostic procedures themselves. Ancient healing practices from around the world recognize the lungs as vital organs requiring special protection. In traditional Chinese medicine, for instance, the lungs are considered particularly sensitive to external influences and in need of careful strengthening. Modern science is now validating some of these age-old concerns about respiratory vulnerability. What many people don't realize is that healthcare providers themselves often take precautions that aren't extended to patients. Radiologists and technicians step behind protective barriers during X-rays, wear dosimeters to monitor their radiation exposure, and follow strict guidelines limiting their occupational exposure. Yet patients, particularly elderly ones, may undergo multiple scans without similar monitoring or protective measures. This discrepancy in safety standards is something every patient should be aware of when considering their medical care options. The medical community is increasingly recognizing that a more personalized approach to diagnostic testing is needed. What's appropriate for a young, healthy individual might carry significantly greater risks for someone with pre-existing respiratory issues or advanced age. This shift toward individualized risk assessment represents a fundamental change in how the medical community approaches diagnostic procedures, particularly for vulnerable populations. You might be wondering why this crucial information isn't more widely discussed during medical appointments. The answer reveals something surprising about our healthcare system. The time constraints of modern medical practice often mean that discussions about procedure risks focus primarily on immediate, common side effects rather than potential long-term consequences. Additionally, the compartmentalized nature of healthcare means that the doctor ordering your chest X-ray might not be the same one treating your unexplained cough months later, making it difficult to connect these events. Here's the revelation that many patients find shocking: the benefits of these diagnostic tests are often calculated based on population statistics, not individual risk profiles. This means that while a procedure might be broadly beneficial for the average patient, it could pose significantly higher risks for certain individuals, including those with existing respiratory sensitivities or compromised immune systems. The decision to proceed with these tests often doesn't adequately account for these individual variations. Another eye-opening fact is that imaging facilities are not required to track patients' cumulative radiation exposure across different healthcare providers. This means that if you receive X-rays or CT scans at different facilities, there's no centralized record keeping track of your total radiation exposure. The responsibility falls entirely on you, the patient, to maintain these records and advocate for your lung health across multiple healthcare settings. The most alarming aspect of all this is that some of the damage to lung tissue from these procedures may be permanent. Unlike some organs, lungs have limited regenerative capacity. Once certain types of damage occur to the delicate alveoli or bronchial structures, full recovery may not be possible. This permanent nature of some lung injuries makes prevention absolutely crucial. What's particularly concerning is the way these risks can compound for elderly patients. As we age, our lungs naturally lose some elasticity and functional capacity. When this normal aging process is accelerated or complicated by procedure-related damage, the impact on quality of life can be substantial. Every breath becomes more precious when breathing itself becomes labored. Understanding these risks and taking steps to protect your lung health can bring profound psychological benefits beyond the physical improvements. Imagine the peace of mind that comes with knowing you're making informed decisions about your healthcare, actively participating in protecting your ability to breathe freely. There's a special kind of confidence that develops when you transform from a passive recipient of medical care to an informed advocate for your own respiratory health. For many people, breathing difficulties create a constant background anxiety that colors every experience. Even simple pleasures like attending a grandchild's recital or meeting friends for dinner can become sources of stress when you're worried about becoming short of breath. By taking control of your lung health and minimizing unnecessary risks, you can reclaim these joyful moments without the shadow of respiratory anxiety hanging over them. The social benefits are equally significant. When breathing is easier, you're more likely to remain active and engaged with your community. The isolation that often accompanies chronic breathing difficulties can be prevented or reversed when you maintain healthy lung function. Think about the conversations you can enjoy without pausing to catch your breath, the walks you can take without worrying about becoming winded, the laughter you can share without triggering a coughing fit. There's also an emotional resilience that develops when you feel in control of your health decisions. Rather than feeling at the mercy of confusing medical recommendations, you become a partner in your healthcare, equipped with knowledge that allows you to ask informed questions and make decisions aligned with your personal values and health goals. This sense of agency is particularly important as we age and face increasingly complex healthcare choices. Remember that feeling we talked about at the beginning, the simple pleasure of a deep, easy breath? By becoming aware of these potential risks and taking steps to minimize them, you're protecting that fundamental experience that so directly connects to your sense of vitality and well-being. As we wrap up this important discussion, let's quickly review what we've covered today. We've examined 5 common medical tests that could potentially harm your lungs: repeated chest X-rays, CT scans with contrast agents, bronchoscopies, improperly sanitized pulmonary function tests, and ventilation perfusion scans. We've explored how these procedures can affect your lung tissue, sometimes with delayed symptoms that make the connection difficult to recognize. But more importantly, we've discussed practical steps you can take to protect yourself while still receiving necessary medical care. Keep a personal record of all imaging procedures, particularly those involving radiation exposure. Before agreeing to any test, ask your doctor if there are alternative diagnostic options with fewer risks to lung tissue. Ensure that proper sanitation protocols are followed for any equipment that comes in contact with your airways. Stay well hydrated before and after procedures involving contrast agents. And perhaps most importantly, don't hesitate to discuss your specific concerns about lung health with your healthcare providers. Remember that this isn't about avoiding necessary medical care. These tests save lives when used appropriately. It's about ensuring that the benefits truly outweigh the risks for your specific situation, and that all reasonable precautions are taken to protect your lung health during necessary procedures. The time to act on this information is now, not after you've begun experiencing breathing difficulties. Lung damage often develops gradually, with symptoms appearing only after significant changes have occurred. By then, reversing the damage becomes much more difficult, if not impossible. This is especially crucial if you're already scheduled for any of the tests we've discussed today. Before proceeding, have that important conversation with your doctor about your specific lung health concerns and how to minimize potential risks. Think about what's at stake here. Your ability to breathe comfortably affects every aspect of your life, from your physical capabilities to your emotional well-being. It influences how fully you can participate in the activities you love and connect with the people who matter most to you. That's worth protecting with every tool at your disposal. I urge you not to wait until your next medical appointment to begin this important conversation. Make a list of the imaging procedures and lung-related tests you've undergone in the past few years. Consider whether any patterns in your respiratory symptoms might correlate with these tests. Prepare specific questions for your healthcare provider based on what you've learned today. Taking these simple steps now could make a tremendous difference in your breathing comfort and overall quality of life for years to come. Your lungs sustain you with every breath, every minute of every day. They deserve the best protection you can provide. And now that you have this information, you're empowered to give them exactly that. Because breathing freely isn't just about physical health, it's about living fully.